Hello. Urodynamics is an objective analysis of urine storage and voiding and has evolved from application of simple hydrodynamic principles to the function of bladder and urethra. So, what are the broad clinical indications of urodynamic investigations in our day-to-day practice of urology? And they are bladder outlet obstruction, urinary incontinence, frequency urgency syndromes, and neurogenic bladder dysfunction. In our laboratory, all patients are recruited by prior appointment. A thorough clinical interrogation is performed to make a working diagnosis. Patients presenting symptoms are thoroughly understood and documented systematically. On arrival, every patient and the accompanying person are given a brief introduction of the test and their bladder diaries are reviewed. At the end of clinical interrogation, we establish a working diagnosis and generate urodynamic questions. For instance, is the bladder outlet obstructed? What is the precise mechanism of urinary incontinence? Is this bladder safe for upper urinary tracts or is this suitable for a renal transplant? What is the possible outcome of surgery? Uroflowmetry is the simplest and the most basic investigation that gives us a platform from which other tests can be interpreted. All other values can then be interpreted taking into account the catheter-free test of the patient's urinary flow rate. This is generally followed by an ultrasound measurement of residual volume by an instrument called bladder scan. That's the flow transducer which measures the urinary flow. This is the infusion pump which pushes saline into the bladder at a set speed. These are electronic pressure transducers which measure accurately the intravesical and rectal pressures. The analog signals thus obtained are converted into digital signals and fed to a computer and projected into the desired form. Filling cystometry is an investigation to assess the storage function of the bladder, and it documents the response of the bladder and the urethra to progressively increasing volume of saline. The parameters measured here are bladder sensations, capacity, overactivity, bladder compliance, and leakage episodes if any. Patient is now prepared, toweling is done, the urethra is gently lubricated and catheters are introduced. One can either use two separate catheters for pressure measurement and infusion, where a small catheter is piggybacked into the large one and introduced into the bladder. Once in the bladder, the small catheter is disengaged and pushed in separately. Alternatively, one can use a double lumen catheter which will serve for infusion as well as measurement of blood pressure. Here, a 6 French double lumen catheter is being introduced into the urethra. All the air bubbles are removed and then catheters are connected to the pressure transducers. While introducing the rectal catheter, an opportunity is taken to quickly check the patient's sacral reflex arc. Zeroing of the measuring equipment to the atmospheric pressure is one of the most important aspects of urodynamic investigation. In principle, transducers must be brought to the horizontal level of the upper margin of the pubis and zeroed to the atmosphere, irrespective of the position of the patient. After this step, zeroing can be done in many different ways. Filling cystometry is an extremely interactive process where the clinician constantly talks with the patient and asks him or her whether the process is able to reproduce the symptoms and, if necessary, by provocative means. Choose the appropriate filling rate, which is approximately one-tenth the value of the functional bladder capacity in mLs per minute of normal saline at room temperature. Detrusor overactivity is a urodynamic observation characterized by involuntary detrusor contractions during filling phase, which may be spontaneous or provoked. Stress urinary incontinence may be provoked by coughing or by valsalva, and it is defined as lowest abdominal pressure at which leakage of urine occurs due to increased abdominal pressure in the absence of detrusor contraction. Voiding cystometry is a method by which pressure-flow relationship of the bladder and urethra is established during the voiding phase of micturition. Voiding sequence is tested in a position that the patient is normally used to, and various points of detrusor pressure and synchronous flow are documented. It is vitally important to understand that the detrusor pressure and the flow are interdependent and are directly related to the force of detrusor contraction and the magnitude of urethral resistance at every point of time in the voiding cycle. Let us therefore understand this interplay of forces. The force of detrusor contraction that we do not measure, the urethral resistance we do not measure, but what we measure is the detrusor pressure, which is a result of first two forces. The uroflow represents the difference between detrusor pressure and urethral resistance. Another factor which is not adequately studied is the changing bladder volume, but ultimately the flow rate happens to be the resultant vector of all these forces working together. In short, voiding is thus a complex interplay of various factors operating in a synchronous manner. Reporting is a second interactive process where the patient's symptoms are once again reviewed, checked whether they were adequately reproduced, and then a careful correlation of symptoms is performed with the traces. After complete and satisfactory interpretation, a report is generated. The first part of the report consists of the complete clinical picture with its interpretation. The second part mentions how the test was performed and also mentions all our findings and its correlation to the patient's symptoms. The third part is the conclusion where our interpretation of all these findings and the final verdict of the case is given. It is our practice to talk to the referring physician and ensure that he has received all the answers to the questions raised by him. The report is finally handed over to the patient and all post-investigation instructions are given. Patient is also advised to visit his referring physician with the report. So, my dear friends, we have seen how a simple application of fluid mechanics to urinary filling and emptying has turned into a major subspecialty in urology. With the evolution of the science of urodynamics, new phenomena have been uncovered, new terms have evolved, and indeed a new language has been written.